Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us here on this Health Suppliers segment with returning guest Vanessa Boo Shelly. She's joining us here once again from CareVitality, and she's going to talk about some of the new changes with the MACRA, or Medicare Access and Chip Reauthorization Act of 2015, and how doctors can stay in compliance, thereby earning the highest bonus in their Medicare payments. She's also going to talk about services that are offered at CareVitality, specifically telehealth care management. Welcome back to the program, Vanessa. How have you been?
I've been terrific. Thanks for having me back, Neil. I appreciate it.
Great. Well, for our listeners who may not be familiar with you when you were here before, give us a brief background about yourself and tell us who Vanessa Boo Shelly is.
Oh, great. Hi, my name is Vanessa Boo Shelly. I'm the president and CEO of CareVitality, a subsidiary of our parent company, EMR and Practice Management Consultants. We've been in business for 10 years. My background in leading the organization is I have a clinical, IT, legal, business and compliance background. So prior to starting this organization 10 years ago, I worked in medical clinics, been admitted to medical school, went to law school for a while where I worked at a law firm that defended physicians, and I worked for a series of health IT vendors, mainly focused in the ambulatory space, where I helped implement and sell the practice management, revenue cycle management systems, and the electronic health records. Then starting in 2009, right before the Stimulus Act came out, where it was basically mandating all providers to have to go on an electronic health record, I started the consultancy to help all providers instead of specific systems. We can work on over 150 different systems I myself have today that has given us the knowledge to help people hit those goals that they had to with the prior law, which was called meaningful use, so they didn't get decremented in their pay, and that they adopted electronic health records. And then in 2015, we created the subsidiary CareVitality, which helps in the new transition to the new law, which is called MACRA, that all providers are now aware of. It actually was announced in 2015 at the same time that a lot of the telehealth codes, such as for chronic care management, were released. Because what it does is it takes the prior requirements for what was meaningful use, which was usability on the electronic health record systems, and it adds helping improve the patient outcomes. So now, because all the providers have their data pretty much on an electronic health record, the government knows that you can report on how well the patients are doing with specific conditions. So they added the care management codes to that to help pay for that time that providers are spending, but it's really not specific for providers, it's specific for care teams, working with patients in between office visits and when they're transitional care management codes for when they're leaving the ER, so that the patients can stay hopefully healthier or maintain their health in their homes instead of returning to the ER, getting rehospitalized, being readmitted. So what they found out is, by paying for these codes, which are, between $40 and $50 for the chronic care management codes, it saves a heck of a lot of money in the long term, thousands and thousands of dollars, by keeping people out of the hospital. So, people don't want to be in the hospital if they don't have to be, right? And helping maintain and monitor their health in their home, which is everyone would prefer, and helping them learn how to manage their chronic condition better.
That's quite an added bit of responsibility on the shoulders of the healthcare provider. Now, in keeping in compliance with all of that data, all of that input, all of that cross-referencing, in return for that, they're reimbursed at a higher or lower rate based on their compliance. And that's where CareVitality comes in helping them achieve that compliance. Am I right?
Yeah, so let's explain. So now we're going to talk about, new changes in the law. So we're walking into 2019 today, and every year the government or CMS increases what they have to do in regards to be compliant. So in the prior years, when they introduced the new law, which it was introduced in 2015, but it went into effect in 2017. So payments providers on a lot of it was primarily based on how successful their patients were performing based on the care that was given, and another 25% was usability on the electronic health record, was at 4% this last year, which I'm finishing a testing clients for that's due tomorrow by Medicare's deadline, which is a 5% impact on their pay. So they can either get incremented or decremented by 5% of their pay based on adhering to what the requirements are for the law. This coming year now, 2019, it's 7% of their pay. So their traditional Medicare payments can be impacted by plus or minus 7% if they are a qualifying provider, and the next year will be 9%. So, and it's going on the program through 2026. So as we got quite a while that it's not moving, that it's going to be here, and who knows what they'll put out next. But what we can talk about, as some new changes, which is helpful, so you can understand how we can be of help, or understand what providers need to understand to move forward in 2019, is that in the quality outcomes, what they've been doing is that there's four sections. So the first section is quality, and where the providers have to submit at least 6 quality outcome measures that they feel are good performance measures for them to be met on. But some performance measures have been around for a while now, and some of the providers are all doing terrific on it, so they call them topped out. So providers need to look at when they're deciding which measures to choose for 2019, which are topped out, because they won't be able to get the full 10 points on those, because everyone's doing well. The government lowers the ability to score maybe 7 out of 10 points, and no one can get higher. The other thing to know about the measures in 2019 is there has been some new measures added, some taken away, so you should all check to make sure that, the measures you chose in the previous years are there. There's a lot of measures now stemming for opiates. So you know how we're trying to decrease the opiate addiction rates in this country. So a lot of my pain management clients, for instance, are starting to look at the new opiate measures to see, because those might be much better measures for them to meet than primary care measures that are really not specific to them. So there's more specialty-specific measures. I think if you're a pain management, looking at the new opiate measures are good to take in account, because you might be able to shine in those areas. And then, and then the other thing which we do is when someone comes to us, we help them strategically understand which are the best measures, which ones are based on their type of practice. We might help them, if you're specialty specific, a lot of these vendors today only pull primary care for you to submit. So we can help match you with a registry that might actually be able to submit your specialty specific measures if your EHR vendor cannot. So that's kind of 3 areas to think about, depending on if your primary care is specialty, that all, specialty can do all 3 points are good. Primary care, probably the first point I discussed.
Well, if I'm understanding correctly, it's basically, even if you're specialized, even more focus your strategies, thereby, I guess, reducing, for lack of a better term, the liability when it comes to getting your reimbursements based on all the other things that you've got to deal with, where you come in and say, hey, this is a whole area that you shouldn't even have to deal with, taking that liability away from that plus minus 7%.
Well, they still have to deal with it, but I think what happens is a lot of providers may not always be submitting their best measures, and I think the specialists don't always realize that there are registries available that they can use beyond their vendor that will just focus on their specialty-specific measures. Okay. So that's even better, because, sometimes the vendor's like, we don't do that measure, this measure, that measure, and their score is not really good because it's a primary care-driven measure they're submitting on their behalf, their EHR vendor. So when I come in, I say, okay, these are the best ones. Let's talk as a team, and figure out which ones you're doing here, and let's narrow that down. And then let me match you with a registry where you can submit the ones that you're doing on a regular basis. So, that's that's the majority of a big bulk of their score is coming through these quality metrics. So, and also these quality metrics and their score on how they're doing incomplete is also, which we've only gone through one section. We'll go through the other 3 sections quickly after this. But those sections, the full score that they will be getting will be publicized on the provider compare report, physician compare report, that you and me and all patients can see how the doctor is performing. So this shows, like they used to have for hospitals, they still do, where they can have star ratings. It's going to be the ratings of the providers. So when people are choosing, which provider they want to go to, say that's a cardiologist, they're going to be able to go and check, well, let me compare this cardiologist's success rates compared to another provider's success rates in keeping their patients healthy. The other go on.
No, the other sector.
Yeah, so the other area, now it involves reputation, this type of new law. So Not only it affects their finances, but their reputation. Then promoting interoperability, which is the section that used to be very similar to meaningful use, that carried over a lot of the things that we help providers on in the past. Now in 2019 has been focused, and some of it has been changed because people have been doing those same measures for a long time, that they've decided let's narrow these measures down and focus them truly on interoperability. So some of the measures that the providers have been doing in the past have been taken away because everyone's been doing them pretty much successfully, and they're making them focus on interoperability. So this means three-pronged. Interoperability with patients, so communicating with patients through the portal. And there's, three areas of the portal, as folks know. So it's like secure messaging, having them be able to view, download, and transmit portions of their chart, such as their note summary for the day or their labs, and then enrolling patients in the portal. So now all three of those are mandatory. Before, just engaging them to join the portal was the mandatory one. Now all three are. Then they've also expanded the registries, which were prior a nice to have, now are all a requirement. And then the other aspect is communicating from provider to provider. So those rates are as well communicating. So now what's happening is there's this thing called Care Quality and Care Everywhere, where people who are on Epic systems are on Care Everywhere. Care Quality is another bulk of the industry, which have all come together to communicate electronically between EHRs. So now it's enabling more of that connectivity and communicating with providers outside of the office electronically through an information exchange. So, what we do here is we work with practices on these areas to help them improve those areas.
You offer a full range, a wide spectrum of telehealth care management services. Where can we go online and get much more information about CareVitality and the services that you offer?
Yeah, so the services that we offer in regards to the telehealth is with regards to the improvement activities, which also improves the quality metrics, which we were discussing earlier. So that's where we come on board for clinics that need additional support, that can bill for these codes, and they still keep a profit, but they augment their team or they supplement their team with us, where we provide the nursing support to manage and monitor the outcomes when the patients actually leave the office. So we do that through chronic care management, we do that through transitional care management, and we also help improve and increase their wellness visits, which has also become a big thing. So we do about 80 to 90% of the visit telephonically that can be done non-face-to-face, where actually the rest of the wellness visit gets finished off in the office and the provider can bill for that extra income. So that all helps improve their score that they have to submit at the end of the year, which directly affects their positive 7%, hopefully bonus we can get those clients up to when working with us, from a consultancy effort on the new law and helping them understand what has to be done in 2019, as well as taking it to the next level where CMS wants it to be, was providing additional support outside the office. So, if anyone has interest in having us help in those areas or help them understand those deeper, or, the new portions of the law, or providing additional care support to build those codes, they can find us at CareVitality.com. Or they can contact us at 800-376-0212. And my name is Vanessa Boo Shelly, and a short email to me would be Vanessa@CareVitality. But we're here to help now and in the future. We've been here for 10 years, and we're very successful, and we're backed by organizations such as the AMA, the AOA, several state medical societies, EHR vendors partner with us. So we have over 30 partners that promote us for helping in these areas.
Thank you for coming back and joining us on the program, Vanessa. Always a pleasure, and always great to hear about the good things that you're doing there at CareVitality. Thanks for joining us today.
Thank you very much.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.